Welcome to True Health Tuesday, and the truth will set you free. Okay, tonight we're going to talk about degenerative joint disease, degenerative disc disease, and the utter failure of the medical system because degenerative disc disease and degenerative joint disease are actually not diseases. They're the end result of trauma, and they have nothing to do with degeneration. Yeah, we'll get into that. And there's a lot of things that we can't talk about. If anyone has ever seen 1984, I encourage you to look at it. Okay, only because you're living it. And Thomas Jefferson said, if a law is unjust, a man is not only right to disobey it, he's obligated to do it. So if you're given information that wakes you up to the fact that injustice is being done, that your rights are being taken away. Oh, I'm sorry, they're not rights. Okay, they're privileges. You thought they were rights. Did you think that you had the right of freedom of speech and assembly and everything? Yes, no, I'm sorry, they were privileges endowed by your government. Okay, now the part that we can't talk about, because the Ministry of Truth, according to 1984, is actually the Ministry of Propaganda, which is how to manipulate the population. We can't talk about this here. Okay, because they'd wipe us out. So we do have the Dr. BVIP. Also, God knows how long this YouTube channel is going to last, because we do have a number of videos that have been on for decades that have been watched by millions of people. So please, subscribe and share, even though we're being shadow banned. Okay, give it a shot. And thank you for all those people that are subscribing to the Dr. BVIP. You'll be watching it uninterrupted by the power of Victor. Not Victor, like Victory. Victor's the actual video guy. He's cool. Honest to goodness, I don't know how you do it, brother. And Extreme Health Academy, they are going to be censoring not just information about the government, but information about health. And Extreme Health Academy is where you can get together and people that have recovered and have health solutions, we get together. I mean, I was with them for 2 hours and 10 minutes on a Sunday. Yeah, so what are you guys doing on Sunday? Okay. So let's get into this. Okay, we're going to talk about the two main types of arthritis. Okay, arthritis means joint inflammation. Osteoarthritis is a non-inflammatory joint inflammation. Okay, wait, let me explain that a little slower. Okay, because you see, the medical system, when they make a mistake, they try to not correct it, they just tend to wash it under the rug. And we're going to go over that when we talk about the censorable stuff, like the test that was approved that dropped the world into panic, and now it's not approved because it doesn't really work. But we were telling you back a year ago that it wasn't really working. So let's just stick on arthritis, okay? Arthritis means joint inflammation. Osteoarthritis means it's a type of arthritis that's a non-inflammatory joint inflammation. Okay, so it's the end result of a trauma. Yeah, if you don't understand it, you're probably understanding it. Okay, rheumatoid arthritis is an autoimmune condition where the body is supposed to attack itself, which is really foolish. Now, rheumatic diseases, you're looking at a whole bunch of them. Okay, rheumatoid arthritis, scleroderma, lupus, psoriatic arthritis. Polymyositis, dermatomyositis. Okay, all of these are in the autoimmune category. But would you actually go to a mechanic that doesn't really know what causes that noise in your engine and let him work on your car? Okay, yeah, so we're going to go into the causative factors of how the body can't rebuild. But let's look at joint structures. Your joints are hydraulic. Okay, that means they're two bones coming together, surrounded by an articulating cartilage, and cartilage is alive. And this is one of the toughest conversations I got to have with medical doctors, because the cartilage in like the top of the knee, you figure your knee is under a lot of stress. Okay, now blood vessels would be compressed under that. So they'll say that the cartilage is avascular. A means without, vascular means blood vessels, and they're right. But it's not acellular. You have cells in your knees. You have cells in the cartilage. And the cells, and this is what you got to walk the doctor through. Are the cells, doc, alive or dead? No, seriously, I actually have to walk medical doctors through this because they're not used to seeing regeneration of cartilage. Why? Because what's the number one thing that you're going to get in a standard medical office today if you have joint pain? Drug, yeah, non-steroidal anti-inflammatory, ibuprofen, Motrin, Aleve, Advil, all of those things. They inhibit proteoglycan production of the building block of cartilage. So if your protocol is as soon as you see a joint pain, you're not going to say, well, gee, what happened? You're over 40, it must be wearing out. Okay, here, take this drug. Okay, you're not going to see regeneration of the cartilage. You're not going to do any critical thinking. So each joint is two bones coming together, surrounded by joint cartilage, surrounded by a capsule, and then there's a superfiltrate of blood in there called synovial fluid. So all the joints are hydraulic. And then you've got bursa sacs around them, and this is to decrease the inflammation of the tendons because the tendons actually cross the joints. So there's a lot of structures in there. And so bursitis means inflammation of the bursa. That means there's not enough fluid to it. And we went over all of bursitis, but we just want to talk about injuries or degenerative joint disease, degenerative disc disease. And you might say, well, hey, didn't you just say they're not diseases? They're not. But when you make a mistake, why not just cover it up with rhetoric? And that's what the medical system does. They're not going to go back and say, gee, we made a mistake. Now, I get in trouble with a lot of people that are viewing these. They say, well, give us the solution first, so I don't want to sit through the video. Totally cool. Osteoarthritis is from a trauma. That means if you have two joints that are together in place, everything else, it could be misaligned. Now, knowing that every joint in your body, you've got muscles that are surrounding it, except for the posterior aspect of the sacroiliac joint, okay? And so that means that there's structures in there. Okay, so if you have altered mechanics, that means from a trauma, you have altered nerve supply or altered blood supply, all of that has to be corrected. Then you correct the misalignment, you restore the blood supply, nerve supply, and the biomechanics, and guess what? It regenerates. Every time you walk, you're creating a negative and positive pressure on those joints, and that regenerates the joints. It seems too simple. Now, if your blood is toxic, like let's say you're dehydrated, you're taking a ton of medications, the blood cells start to get clumpy together. Let's say you have poor sleep patterns. Okay, that means you're not going to be able to regenerate the joints. So you have to look at the physical, chemical, and emotional stressors that are going to limit your body's ability to regenerate. Because when people say it's repetitive motion, it runs in my family, none of that stuff is true. Okay, because people can do the same repetitive motion job and not have the issue. I mean, you've seen checkers at the store. Of course, now they look like this, but you've seen checkers at the store, okay? And are there people that can do that job and not end up with carpal tunnel syndrome? Absolutely there are. But if you have somebody that's had a trauma in the past that tries to do the same job, okay, they're going to have altered nerve supply, altered mechanic, high stress load. What if a person has poor sleep patterns? Okay, that's when your body regenerates. So if you look at joints, okay, damage, degeneration, arthritic changes, that's a tissue production problem. So you have to look at the physical, chemical, emotional stress. To think that a shoulder injury is just involved in the shoulder and not the nerves that supply it or the biomechanics or a distortion of the thoracic area, that's just dumb. That's not critical thinking. Okay, does that make sense? Rheumatic diseases. Okay, this is where there's cells that are actually breaking down the cells. So again, it's a tissue production problem. A tissue production problem. So you got to correct the mechanics, but 80% of your immune system's in the gut. So you got to heal the gut. And you're going to see 100% of people with rheumatic diseases, they're going to have pink skin, like you'll be able to touch their skin and it'll turn white. Okay, or there's going to be some gut issues, okay, and that's going to be histamines are released. So 80% of your immune system's in the gut, so you got to heal the gut. That means, so what are the causative factors? Anything that'll damage the gut. This means medications, toxic food, environment, chronic stress, that'll damage the gut. You got to get the blood healthy. And when we're working with autoimmune conditions or just about anybody, we do live blood cell analysis at our Huntington Beach office and our office in Tijuana. Why? Because if the blood is not healthy, if you're in a stress state, instead of these beautiful red blood cells, okay, they start to clump together. And so they can't filter out through. That's also why the blood gets toxic in type 2 diabetes, and so it can't filter out on the joints, so they have joint issues. So you got to make sure the blood's healthy and then eliminate the toxins, because there are so many chemicals out there and so many medical procedures that cause your body to attack itself. And we're going to cover those as much as we can, given the restrictions within our socialist or our environment now. Okay, now let's go to the Mayo Clinic. No, I didn't hear angels sing. You only hear angels sing when I say, God Fauci. I know it's kind of the same if you say God and Fauci at the same time. You know, it's like saying, you know, doctor in DC. Okay, but no, you know, he's infallible. Okay, well, the Mayo Clinic is up there too. Okay, they know just about everything. Doctors, except for this, doctors don't know what starts this process, although a genetic component appears likely. While your genes don't actually cause rheumatoid arthritis, they can make you more susceptible, such as certain viruses, bacteria may trigger the disease, blah, blah, blah. We don't know. Okay, right. Are they looking at the physical, chemical, emotional stressors? Do they think that maybe the course of antibiotics that the person went on that destroyed the gut flora, that caused an inflammatory response, could be a contributing factor? No. There is no critical thinking. Now, Dr. David Sackett, and there's a famous quote that he gave on medical schools, that half, and this is what he's speaking towards medical students, half of what you'll learn in medical school will be either dead wrong or out of date within 5 years of your graduation. Within 5 years. The trouble is no one can tell you which half, so the most important thing is to learn on your own. Yes, once you've completed that, you're going to learn on your own. Where are you going to go to school? Okay, where you're going to get continuing education classes. Who are those funded by? Yes, the natural health industry. No, the pharmaceutical industry. I'm just kidding. Okay. Yeah, so you're going to learn what drug for what therapy, okay? And the humans are never suffering from a lack of drugs. Here's the real causes of rheumatoid. I know, I left that in there. I'm sorry, this is from an old lecture. The Ministry of Truth, please forgive me. Okay, or the Ministry of Propaganda. Okay, antibiotics, that destroys the gut flora. Many medications can cause your body to turn on itself. Environmental toxins, processed foods, sedentary lifestyle, and the three stressors, the physical, chemical, emotional stressors. Now, it's interesting because autoimmune diseases, where your body is literally attacking itself, okay, are on the rise. Now, why would that be? Now, this article is from 2012. They're saying with a rapid increase in autoimmune condition, and it's one of the fourth most popular types of diseases now, it suggests environmental factors due to significant increase in these diseases. Genes do not change in that short period of time. Well, you know, Mayo Clinic maybe should learn how to read this article, okay? Because they're saying it might be genetic. Really, genes don't change. Now, when we look at this, the role of an inflammatory autoimmune disease in the diet, okay, so are the polyunsaturated fats that we're exposed to, are the food preservatives, the chemicals in the food, the glyphosates in the bread, could those all be a factor? No, no one's looking at it, even though all of those can negatively affect the gut, where 80% of the immune system is. Now, developed societies, although having successfully reduced the burden of infectious disease, and that is not through medications, okay, or injectables, that was through what was it? Oh, sewer systems, refrigeration, clean water. That's about 80% of the, 90% of the changes. However, now we're experiencing metabolic, cardiovascular, and autoimmune diseases thrive. So these are man-made diseases, are thriving now. Now, Polyunsaturated fats, you may have heard this, term, but they're in almost every packaged food. Like if you're looking at soy products, you're looking at every clear oil on the shelf, these oils actually create free radicals, and free radicals damage healthy tissue, causes plaque to build up on the walls. So think of this. If all the joints in your body are two bones coming together and you need healthy blood flow going to them in order to produce the synovial fluid, but you are taking a chemical, that's masqueraded as food, does that make the blood not healthy? Yes or yes? Yeah, and so further damage. Now, rheumatoid arthritis is one of the most popular, autoimmune diseases. And it's interesting, the CDC, again, that's close to great God Fauci, but they just changed their mind a couple of times. They say occurs when your immune system attacks the synovial, the lining of the membrane surrounding your joints. So you have cells that are attacking that synovial membrane that holds the fluid inside of the joint, resulting in thickening, inflammation, thickening of the synovium, which can eventually destroy the cartilage and bone within the joint. Yeah, you're shutting off the nutrients. You're shutting off the bloods, how the thing reproduces itself. So it's a tissue production problem. Think of this, it's a tissue production problem. So if somebody has joint damage, knowing that the joints in my hand are not 61 years old, they're constantly being renewed. Heck, the blood's only 120 days old. So you are a tissue production machine. So if you have a tissue production problem, that's bad. So now we've got something that's triggering an inflammatory response, something that's triggering bad stuff to happen to your cells. Does that make sense? We're going to go into some solutions. This one, read this. You can get this on a PDF form, the DMSO Handbook for Doctors. Now, DMSO has been around over 100 years, but it's been used in industry, and it's been used in veterinarian, and it's been used in a lot of studies. But again, if it's cheap, readily available, and effective, but you can't really put a patent on it, do you think the pharmaceutical industry will allow this product to get on the market? No. Well, I mean, it's approved by one thing. It's approved to be injected in the bladder for interstitial cystitis by the Fraud and Deception Association. Food and Drug Administration. Now, here's another article. So, just get that book, read it, look at it, and work with a healthcare professional that's going to work on the dosage. And you're going to see it's very, very simple. And then there's also some side effects of it, like a garlic odor or an oyster odor that can be taken care of with raw milk and cheeses. But let's look at the PLOS 1. Now, this was 2016. DMSO represses inflammatory cytokine production in human cells and reduces autoimmune arthritis. Wow. So the body magically attacks itself, and there's nothing you can do except take steroids, or this DMSO seems to work. Dimethyl sulfoxide is currently an alternative treatment for various inflammatory conditions as well as cancer. And then it goes in inflammatory cytokines. Cytokine just means type of cell, inflammatory cells. And inflammation, get this, inflammation is how your body heals. It's not a demon attacking you. If you scratch or you damage tissue, histamines are released and inflammation occurs. Inflammation is how the body regenerates tissue. So have you ever heard of an anti-inflammatories like on the TV? Advil, Motrin, Aleve. What do they tell you? Take this and then go golfing all day long. You'll feel great. Of course, side effects will be kidney damage, brain damage, and then they run through like 20 different things. Of course, you're not going to hear that with the injectables, but they have to do it legally, because they got to tell you all the effects. Some people will call those, side effects, you're right. No, but these are the effects of taking the drugs. Now, anti-inflammatories that are natural deactivate the free radicals. So inflammation is going to tear down everything to bring you brand new tissue. But those free radicals can damage healthy tissue. So antioxidants deactivate those free radicals. So it makes inflammation work. So when we tell someone, because we're causing inflammation at the joints to regenerate the joints, we tell people to take anti-inflammatories like a blueberry smoothie or green juice or turmeric. I mean, all the plethora of things in nature that have antioxidants that deactivate those free radicals, so it makes inflammation effective in building the tissue. Does that make sense? So now let's get into the study. So it represses inflammatory cytokines, so it must do something with free radicals. Now, suggests that DMSO acts on the signaling pathways suppressing inflammatory cytokine production. Topical administration of DMSO significantly mitigated the KBNF serum-induced arthritis in mice, and it was associated with reduced levels of pro-inflammatory cytokines in the joints. While we cannot confirm the efficacy of DMSO as an anti-cancer agent, the use of DMSO in arthritis warrants further investigation. When you get that book and read it on DMSO Handbook for Doctors, you're going to see it's wild. I've been experimenting around with this, and I'm working with somebody who's been working with this for 15 years. And I've noticed on myself, since it is an industrial solvent, okay, I've noticed taking it and I drink tons of water, a couple of these guys a day. And I noticed my first week and a half, my urine was dark in color. Now, I've worked around chemicals my whole life. I'm talking thousands and thousands of sheets of particle board I've cut. So that's formaldehyde, okay? We're talking endocrine disruptors. We're talking acetone. We're talking asbestos. When I was a little kid, I'm ripping out asbestos tiles, okay? So years of chemical exposure. And I noticed a massive difference in joint issues. And I just thought it was because I was run over by a car, dropped off a building, and had a few accidents. No, really, that's how I justified it in my mind. Not that I'm 61 years old, it's just that some of my joints have been damaged so far that they're distorted. But that's not true. I've noticed a massive change in joint issues. But let's look at other stuff. How about vitamin K2 and rheumatoid arthritis? Modern Rheumatology Journal, apoptosis, that means programmed cell death of the rheumatoid, of the synovial cells that are damaging it. So, do you hear this from the Mayo Clinic? Look, get some vitamin K2. What about turmeric? Do you hear this from the Mayo Clinic? No, but Arthritis Research and Therapy will. Microenvironment which affects the pro-inflammatory cytokines. Again, the pro-inflammatory cytokines. So inflammation, it's allowing some of them, but it's deactivating the free radicals. This strategy may support the regeneration of articulating cartilage. So when you hear a doctor that says, well, your cartilage won't regenerate. Really, doc? Okay. You wonder what operation he had to remove his common sense. Okay, now, remember, we're talking about the body attacking itself. So this is an immune system mediated thing. Now, this is, please, Mr. Ministry of Propaganda, Truth, okay? This is from 1971, before they passed the Vaccine Adverse Event Reporting System, the VAERS, in 1986. So back then, you could still talk about injectables, okay? Out of the Journal of Immunology, September 1971, arthritis associated with induced rubella infection. It is suggested that repeated episodes of arthritis which follow rubella immunizations may be related to the continued presence of the rubella virus in the affected joints and synovial. So it turns out that injecting things in your body, particularly foreign proteins, can have a different effect on your body. Oh shit. Here's one from 1983, Viral Infections and Immunity. Prospective immunological assessment of arthritis induced by rubella vaccine. I better not read that anymore because we could get in trouble. Wait, Here's another one out of 2000. It's in PubMed, the National Institute of Health. Okay, yes, remember, everybody will censor anything, even the CDC and National Institute of Health, even if it's true in our current society. That's why I'm encouraging you to watch 1984, okay, or at least see a synopsis of it and realize that we were living in that controlled society. Okay? So now let's look at, so rheumatoid arthritis, find the physical, chemical, and emotional stressors, heal the gut, get the joints working correctly, detox the system, okay, and get healthy nutrients in the system. It's a tissue production problem. Now we're going to get into a trauma, the results of a trauma. Now you're looking at grade 1, grade 2, grade 3. Grade 1 means there's no change in the joints or disc, the bones or the disc, but there is a misalignment, okay? Now, what happens is discs have a horrible blood supply because they're under such a great compressive force. They get their nutrients through movement. Okay, now that movement, it causes a thing called imbibition, which allows fluid to get into the joint. So what happens is trauma, bam. Okay, now is the body smart or smart? Okay, good. Yeah, I'm going to help you on this one here. I know it's late. I've been up since around 4:30, so I want to help you out. Okay, so you got a trauma. For every 1 inch the head's forward, the pressure on the disc double. So when that head goes forward on that grade 1, instantly the shoulder muscles are going to tighten up and reposition. Now, knowing that all the nerves that come out of the neck supply the upper shoulder, arm, and the breathing muscle, the phrenic nerve, I mean, it supplies a lot of stuff. 97% of all headaches are coming from the neck, so if that heads forward, you're going to have a lot of symptoms, okay, after a while. Okay, but what do you, in this country, do we actually respect that the body is adapting to physical, chemical, or emotional stressor, or do we drug the symptoms? Because remember, you're going to have continuing ed, your doctors. Who covers that? Yes, the pharmaceutical industry. Okay, so we're going to give them a muscle relaxant, anti-inflammatory, even though that destroys the building block of cartilage, and you know, some more drugs like a sleep medication because he's not going to sleep well. So that goes to grade 2. Now what happens is you've got two bones and you've got a disc. When that disc gets smaller or compressed, does that neck become more stable or less stable? Now that spine surrounds the spinal cord, which is a long tubular brain that keeps you alive. Okay, so what's going to happen is the bone's going to start to distort to stabilize it. And if you look close at these joints, every time the morons say, you know, or the more drug doctors, okay, say it's degeneration, really? Or is it adaptive? Okay, is the body laying down bone? Now there's a law called Wolff's Law, bones lay down where it's needed, resorb where it's not. So you literally will see distortion of the bone where compression of the disc is. It's adaptive. And if you're doing actually post x-rays where that disc starts to regenerate, you'll see the bone spurs go away. Again, that's Wolff's Law. Bones lay down where it's needed, resorb where it's not. So what we're looking at, this is how the body actually works, okay? Now some people will say, well, subluxation doesn't exist. Okay, sub means less, okay? Lux is light. Action is a result of, okay? So if you have, imagine if there's a life force in the body. And this is where a lot of the medical world, which has really done a great job on the health of Americans. Okay, they say, oh, chiropractors, they're like a religion. You talk about the life force or nervous system. Yeah, there is a life force entity in the body. Okay, there is a spiritual aspect. And you have to look at the physical, chemical, emotional aspect. Yeah, absolutely. Let's look at the mechanical distortion of the spine, though. First, we have a trauma. Kinesiopathophysiology means there's an alteration of movement. Okay, can everyone agree that if there's a trauma, there's going to be an alteration of movement? Okay, if not, come up here, I'll slap you in the head, and we'll see how your body moves. Okay? Neuropathophysiology, so knowing that body, if there's a trauma, instantly the muscles that run from here down to the bottom, they're not under conscious control. They're going to increase in tone to protect that area. Okay, so that's the neuropathophysiology. Then you've got the myo, the muscles are going to spasm out. Then you've got, if the muscles and the movement, okay, are altered and the nerve supply is altered, okay, guess what's going to happen? The cells are going to start to change. There's going to be an inflammatory response. And histopathophysiology means the cells are literally going to start to change and adapt to this new environment. And then you have the pathophysiology, where literally there's going to be destruction of the structures inside and around that are supplying it. So those are the results of a trauma. Now, it's interesting. When I taught the lab for biomechanics, Kirkcaldy and Willis is like the biomechanics Bible. Okay, Punjabi and White is pretty good too, but Kirkcaldy and Willis was I mean, just brilliant. Now, what they did, they wanted to see, you know how people, I'm talking the more drug docs, okay, that they'll go in if you have joint pain, and if you're over, say, 30 or 40, you know what they're going to say? Must be arthritis. Here you go. Here's the medication. No exam, no x-rays, no nothing. Raise your hand if that's ever happened to you. No, I'm sorry, your joint hurts. You can't raise it. Okay, so what they did, they took old cadaver bones and young cadaver bones. And let me tell you, I've dissected older people and younger people. They put them through compression and torsion tests, and they found out the joints and were just as strong in old people as they were in young people, because the joints are about the same age. You're always laying down new tissue, building new. I mean, you're tearing up the old, building the new. It's fantastic. So many elderly joints prove to be just as strong in torsion and compression as the younger ones. So as we age, your body is always reproducing it. One of our patients, her mom, is 109 years old, okay, and not taking any drugs. And I know what you're thinking. That's how she got to 109, okay? Yeah, you know, and she's now, you know, trying to get out and meet people, but she's really sad because she can't because of the environmental and governmental restrictions. This is normal. As we age, we should be healthier. We should have more time to work on our body. The fact that you're seeing older people in wheelchairs means that the system has failed them. Okay, they might have great blood pressure, but they don't have enough blood going to their brain to stand. Okay, they might have no joint pain, but their muscles don't work. Okay, do you understand? This is a failure of the medical system to maintain the integrity of health. Now, do you think that gal there, who's like the oldest yoga instructor on the planet, okay, that she's taking the right amount of cholesterol drugs and the right amount of type 2 diabetes drugs and the right amount of this, and, you know, or do you think she has a good diet and health? And this is what we tell everybody. And try this with your relatives. They could be taking the 10, 15 different drugs, okay? Blood pressure, cholesterol, type 2 diabetes. Why not? Okay, the big three. None of those are diseases. They're all responses to stress. And you tell the patient or your relative, you and me, we're left on a deserted island. All we have is fresh fruit, fresh vegetables, fresh fish. You have no access to pharmaceuticals. Will your health improve or decline? What do they say? 100% of the time, my health will improve. Everybody says that. We know. You eat right, exercise right, your body can regenerate tissue. So when you look at this, bulging disc, slip disc, herniated disc is not just a problem of the discs. Okay, if you're thinking that, look at the surgery statistics. Okay, we talk about that on back pain. You know, you get one, you're looking at a 40 to 60% failure. You get two segments, you're looking at 70 to 80% failure. Three segments or more, it's a 90% failure within 5 years. And why? Because if you're going to fuse this in a reverse curve, what's a reverse curve? That means that this person tore the posterior longitudinal ligament and had a whiplash trauma. You're looking at grade 3 arthritis. So this is a 20-year-old injury in this person's neck, forward head carriage in reverse curve. Now, the only way you can see if you can fix it is by doing a stress x-ray and getting corrective care. Mind-blowing. If you could appreciate how tough a disc is, you can take a probe, and a probe looks just like a pencil, okay, a little bit thinner. You can pass it into bone pretty easy. You can't beat it into a disc with a hammer. You got 80 interconnecting rings of ligament. So for a disc to be blown, you're not going to blow it when you're coughing or sneezing, although that is what the doctor is going to tell you. You sit down, you cough, you sneeze, you're trying to poop, you're straining. Ow, my legs just went numb, holy moly, that fragile disc. No, it had to be damaged for years. Now the key is 90% of the nerves that come off that spine, there's no pain fibers. So you have to have 90% of that thing crushed for you to be aware of a problem. Okay? So this is not, you know, oh, my back just went out. And what's the doctor going to say? You bent wrong. Okay? Have you ever heard that? You bent wrong or turned wrong. Or don't lift and turn at the same time. Okay, Doc, you and me were going hunting 2,000 years ago. You make a beautiful shot on an ibex. I mean, I'm just like impressed as all hell. Hell of a spear throw there, buddy. Okay, and when he goes over to pick up that our dinner for the whole tribe, am I going to say, be careful, don't turn while you lift? You see how ridiculous it is? Okay, and if you're taking high blood pressure drugs, make sure you check your dog or cat, because we want to make sure that those animals have healthy blood pressure too. Okay, you got to give the pattern interrupts, because people just say, no, I have to have it because my doctor says I have to have it. Okay, this is MRIs, which are completely inaccurate if you're looking for disc injuries, because they're generally done with your laying down and the force loading changes it. But if there's a loss of curve, there's going to be an alteration in function. That nervous system is hugely important. And so if you have anything, remember, thoughts flow from here down to get the body working. Christopher Reeve damaged his neck. He didn't damage his legs. Okay, but he couldn't walk. He couldn't move his arms. He needed help breathing. So this, if there's any problem with the neck, and that's why we call the neck the arc of life. My boat is named ARC, A-R-C. No, I did not misspell it. Okay, I wasn't thinking of Noah, I was thinking of the arc of life, okay? And that's what we call the neck. That's how important it is. So if somebody comes in with breathing issues, with carpal tunnel syndrome, with virtually anything, we're gonna check the structure. Does that make sense? Now, is this degenerative disc disease, that's what you would list it down if you're going to write and bill insurance, or is this an adaptation to altered biomechanics? What do you think? Just some random disease that's going to hit a couple of joints, or do you think it's actually an intelligent response by the body based on a trauma? Let's look at this, okay? High blood pressure, knee issues. That is a before and after x-ray. If this person was left in this structure, are they in a stress state? Yes. No, it is not your film, sir. Okay, before and after. Okay, look at this. I mean, when you're looking at knee issues, if you have not had your low back and pelvis looked at, okay, because what you're looking at here is the knees, they're desiccating or drying up. Now remember, all the joints in the body, they're two bones coming together, surrounded by a joint capsule filled with fluid. Now you have a calf muscle that has a pump in it. It's called the soleus. Now this person's knees are in pretty good shape, kinda. And this is what I explain to my patients. Okay, it's desiccating up. It's gonna hurt like hell. Okay, the patella is way the heck off to the side. So you have a patella tracking issue, you have a desiccation of the joint. Guess what else? Bunion formation. So that means their gait's off. What else do they got? We've got the lumbar, which supplies the knee area, the L3. Okay, does that look healthy, or does that look like there's a problem? So it requires a little bit of investigation and critical thinking to find out why the knee is a problem. If someone says, well, I used to be in a flooring, or I used to do this, one of our patients, 5 Super Bowl rings, running back. And I don't know what that means, but, because I don't watch a lot of football, but I guess they're running. Okay? Okay? I've seen a couple of games, but, I was like in the 80s, I was more interested in the cheerleaders. Okay? So I'm telling you, the Raiderettes were amazing in LA. Okay, but this, 5 Super Bowl rings, he's in his 60s, perfect hips. Perfect. I mean, teenage hips. So you cannot tell me that joints wear out. They don't. Nobody works like this guy. Heck, he's jogging all the time. So this one, and we're looking at 20-year-old trauma, middle picture. That's his post x-ray, and that's after 30 adjustments. So we're changing the forward head carriage, we're getting the curve back a little bit. But how, when you got that middle picture, how can you tell the person that you can fix it? Okay, and this is for every doctor out there that's actually going to want to fix people and not drug them. What you do is you see a problem, then you take a stress x-ray to put it in a curve to see if the joints are still viable. Is that common sense? Is that too much common sense? Okay, so if it does work, Then you do a force loading on it, just like you would change teeth, give them some exercises to restore that forward head carriage, and guess what? Take another film to document that you're fixing it. Wow, what a concept. Imagine physician responsibility. We wouldn't have people in wheelchairs. Okay, yes, I know your cholesterol is better and your blood sugar is better, but you got dizzy because you don't have enough blood flowing to the oxygen because we're not looking at the quality of the blood. I mean, none of that stuff would be happening. The doctors would actually be responsible for the health. Got before and after. Acro yoga. So if you think yoga is like, stretching and nice, no, holding one person and the legs are going up like this and you're going like this and then you're going to do a cartwheel. Yeah, wow, cool looking, but bad for the neck if the partner let go. Okay. Now, one of the things on this, and I kept this one up there for the hard palate. You'll see I got it marked with a red line. What's interesting, the hard palate's supposed to be level. Now, if you move 15 degrees up or down, it's not going to affect the neck. You move more than that, it can affect the neck. Okay, so when you're doing a pre and post x-ray, we've got a new x-ray guy, and we're training him second week. Don't tell him, but he is really good. Okay, I mean, he's already a little irritating to deal with, but I mean, a week and a half, 2 weeks, and he is nailing most of them. I think another week of training and he'll be able to post the x-rays on the files. But this is what we tell him. It's so important to do the first x-ray so that we can have an objective analysis for the second one. Again, you're looking at reverse curve to restored curve, and you're going to start to see the disc spaces regenerate. You're going to see the bone spurs go away. This one here, how do you tell if there's a disc injury? If you say an MRI, that's inaccurate. Why? Because inflammation distorts it and body position distorts it. So if you're laying on your back, you got the butt and the thoracic area pushing up. Best way to check for a disc injury is to stand up straight, bend to one side, bend to the other side, and see how it moves. And then you're going to see abhorrent motion. So when you're bending to the side, the disc should open up like you would think. Okay, if you have a disc that's opening like this, where the open wedge is on the concavity, you know that's abhorrent motion. Now think of this, the muscles on either side of the spine, there's no conscious control. They're called postural muscles. So you have to do a dynamic x-ray, weight-bearing x-ray to identify the biomechanics. I mean, it's just brilliant. This is a crime. This gal was able to carry a 60-pound sack of concrete across her yard before the surgery. We're working on her, and you can see the film on the left. We have 2 working bones in the neck. The rest of it's fused. And there is no reason in the world the surgeon needed to fuse that. He just wanted to have the whole spine stable. Now, this is beyond ignorant. Motion and the sensors on the spine communicate to the brain. Okay, so you have all these proprioceptive sensors. You've got them in the joints, you've got them in the muscles. They're called muscle spindle receptors. And so lack of movement gets lack of stimulus. And what will this cause? This will cause shaking, tremors, everything. Now they can't remove this because in order to put all this hardware in, they had to chisel out some of the bone. So she's always going to have this. I mean, mind-blowing. But let's look at pain, because again, the utter failure of the system is to drug symptoms without looking at the cause. And could you say that with virtually every condition out there? Inflammatory bowel disease, drug people until, without looking at the cause. So here's Purdue executive. Now, I know what you're thinking. All pharmaceutical industries are sent by God and they make infallible products. 2001, addiction is not common, addiction is rare in the patient who is properly managed. With many doctors convinced that the drugs pose few risks, prescriptions skyrocketed, and so did addiction. Have you heard of the opioid crisis? Brought on much worse by the governmental restrictions making people not want to work, or not being able to work, shutting down their businesses. Now we could look at Vioxx. or their cousin Celebrex, which is still on the market, but it was approved in 1999. Now, this is after years of placebo-controlled trials, years of trial, and they weighed the risk and benefit, because there is no medical procedure on the planet that is 100% benefit. Nothing. Okay, so you got to weigh the risk and benefits. Now, it was approved in 1999, pulled off the shelf in 2004, so about 4 or 5 years. Okay, you're talking $3 billion it made. Killed over 100,000 people, up to 100,000 people, but because it caused heart issues. Nobody got arrested. Nobody went to jail because there's no liability for it. Institutional corruption of pharmaceuticals and the myth of safe and effective drugs. The myth of safe and effective drugs. Largely hidden epidemic of side effects of the drugs that usually have few offsetting benefits. Remember, risk-benefit ratio. The pharmaceutical industry has corrupted the practice of medicine through its influence of what drugs are developed and how they are tested and how medical knowledge is created. It's interesting because they are now, actually they do have the technology of putting a sensor in the drugs to let the pharmacist know whether you've taken the drug. So if you're thinking that getting this in order to go grocery shopping or traveling, like if I told you this a year ago, you'd say, no, not on my watch. Okay, now people are lining up for it. Okay, this is going to be the next step. You are going to lose autonomy of your body. You're going to lose any informed consent. Okay, and if you're curious, just watch CNN. Cardiovascular effects. Now, this is over-the-counter drugs, heart issues, gastrointestinal issues, hearing loss, GI bleeding, congenital heart failure, miscarriages. So what else can you do? Okay, for one, don't take a drug to cover up a symptom. Appreciate that your body is intelligent. Your body is responding correctly based on the stimuli. If you're correcting the physical, chemical, and emotional stressors, then you're giving your body a chance to regenerate. So what if you got the best chiropractic care? You're getting that sucker in alignment. Okay, you got the organic plant-based diet, all your supplements are whole food, amazing, but you sleep like crap. Are you ever going to get better? No, because that's when your body regenerates. So you got to look at everything. Let's say you have a great diet, you sleep fantastic, okay, but you're not getting the joint realigned, okay, or restore the biomechanics or proprioception. You're never going to get better. Vitamin D and K2. Take them and make sure that you put a mineral supplement in there. Fantastic. Optimizing the gut flora, that's 80% of the immune system. Turmeric, and we're looking at phytotherapy research. Anti-inflammatory, why? Because it takes care of the free radicals, antimicrobial, antioxidant, anti-neoplastic, that means it's good against cancer. And I got to tell you, try it in milk. Try it in soups. It tastes good. Not everybody has to be married to my Pakistani wife. Okay? To learn that turmeric is really, really good. And you look turmeric and black pepper, oh my gosh, you're talking health food. And what was that? Let food be your medicine and medicine be your food. You've heard of that? It's smart stuff. So when we talk about disc regeneration, about taking charge of your health, we put these 5 things up, but think of it. If you have proper nerve supply, that means you've got good nerve going to the joint, but you all have good sensation going into the brain. So you know whether whether your body should elevate blood pressure or elevate cholesterol or lower blood pressure or lower cholesterol. Your body is responding correctly based on the stimuli. Exercise, that means every joint's got to move every day. You move the joints, you make them healthy. Proper nutrition, that means if man make it, you don't eat it. Okay, sufficient rest, that's when your body regenerates, and prayer and meditation. Nowadays, is prayer and meditation important? Yeah, just like Lincoln. We've got no place to go but our knees. Okay, and we'll keep the knees healthy so you can pray. Okay, now this next part, we have to leave the propaganda ministry, the ministry of truth, which is also the ministry of lies, the censorship, and don't worry about it. Even though the president, what's the Psaki one? The spokesman for the White House is saying that they're going to be monitoring your phone calls and monitoring your private messages for misinformation. Again, I would encourage you to watch 1984, okay, or at least look at the synopsis of it to know what we're going through. By the way, in 1984, they did a couple of things that are interesting that we're going to go into in a moment. So I'll see you later, everybody on the standard Facebook and YouTube. God bless you. Thank you for supporting us. Please share these videos. Nobody knows how long they're going to be on. And for those that are watching the Dr. B VIP, it'll go on uninterrupted.